Similar to scanning for an appointment, in this video I will demonstrate a quick scan. Essentially, by using the quick scan, the user is accepting the defaulted criteria, thereby saving time in the appointing process. Scanning locates openings matching this criteria while giving your patients various times to choose from. Note: the patient's name along with other helpful information is displayed on the title bar of the scheduler. Select Scan from the command bar. I confirm that this is the correct patient by clicking OK, or optionally use Find to locate a different patient. Next, the reason for the appointment is determined. This is typically done by selecting one of the user-defined quick procedure buttons or using the treatment plan lookup to appoint a planned treatment phase. Pertinent appointment information is defaulted but may be changed here. At this point, I have decided to use the system defaults for the remainder of my setup. This includes providers, times of the day, days of the week, and date in which to start the scan. To bypass these, I simply select the Scan button. Available appointment start times are displayed in gray. Choose a time to place the appointment. Double-click on the time slot to display the detailed view for the selected time. Place the appointment by double-clicking in the desired time slot. Because I want to save time, I have set my system to use the user logon as identification on the appointment.